Hi, my name is Shinsuke Yasuda.
Hello, my name is Kamiya from TMDU.
Today, we'd like to talk about our new findings on muscle cell death in inflammatory myopathies. Idiopathic inflammatory myopathies, or IIMs, harbor heterogeneous systemic muscle diseases such as polymyositis, PM, dermatomyositis, DM, and other myopathies. Among these, PM and DM are relatively common. You can see here the MRI and histopathology findings from a patient with PM. Treatment for IIMs still largely depends on glucocorticoid and non-specific immunosuppressants, in contrast with advancements in targeted therapies for rheumatoid arthritis and other autoimmune diseases. To make things worse, many patients were resistant to immunosuppression and require long-term steroid use. Moreover, patients sometimes suffer from various adverse effects such as glucocorticoid-induced myopathy and infectious diseases. So, there exists unmet needs for a novel treatment strategy for IIMs. In PM, muscle fibers are attacked by cytotoxic T lymphocytes, or CTLs, and undergo cell death. Muscle fibers are resistant to apoptosis since they are terminally differentiated multinucleolar cells that express various anti-apoptotic molecules. Here, Dr. Kamiya questioned how muscle fibers are damaged in patients with PM.
Here, we analyze the form of cell death of muscle fibers and the effect of its inhibition using human muscle samples and cell and animal models of PM. First, we examine the form of cell death in muscle fibers of PM. Here is a muscle specimen of a PM patient. The dying muscle fibers did not show epitosis features such as tunnel positivity and expressed necroptosis-associated molecules, including phosphorylated MLKL. Next, by using the cell model of PM, we also showed that CTL-induced myotube death was inhibited by necronase and necroptosis inhibitor, but not by ZBAT and apoptosis inhibitor. Therefore, we confirmed that the form of cell death in muscle fibers in PM is necroptosis. Necroptosis is an inflammatory form of cell death, since the cells undergoing necroptosis release inflammatory mediators such as DAMPs. We then considered if necroptosis of the muscle fiber exacerbates inflammation and examined the effect of its inhibition with necronase on CIM, a murine model of PM. Notably, necronase suppressed muscle weakness and muscle inflammation. HMGB1, one of major DAMPs, is released from cells that undergo necroptosis, and we have confirmed that HMGB1 was markedly elevated in the serum of CIM, and necronase treatment suppressed HMGB1 levels. As HMGB1 has an adjuvant effect to accelerate the inflammation, we then examined the effect of its inhibition on CIM using anti-HMGB1 antibodies. We also found anti-HMGB1 antibodies suppressed muscle weakness and muscle inflammation. Conclusively, we found that muscle fiber necroptosis and subsequent release of HMGB1 aggravate PM. We expect muscle fiber necroptosis could be a novel treatment target of PM. Necroptosis of the cells in targeted organs results in spreading a lot of alarmins such as HMGB1 that strongly enhance inflammation. Inhibition of necroptosis is a potential new treatment strategy in inflammatory myopathies that can retain muscle strength while it does not deteriorate the immune system.
In fact, anti-necroptosis treatment has been considered in inflammatory diseases such as psoriasis and COVID-19. We hope this novel non-immunosuppressive treatment provides patients with inflammatory myopathies with less side effects in the near future. Thank you for listening.